So on this video, I want to address the topic of the Isthmocele, or also better known as a cesarean scar defect, or CSD. Now, interestingly, the cesarean section itself, when it is performed and the patient is after 28 weeks, there's a segment of the cervix that moves up and becomes what we call the lower uterine segment. So if this is the cervix, the upper third of the cervix stretches out and makes the lower segment, which allows us then to do a cesarean section or cut open the uterus in this passive segment. And that is why it's easier, it heals nicely, instead of doing a Caesar in the upper segment, because the upper part of the uterus, once the baby's out, has to contract down. But at the same time, this lower segment, once the baby's out, becomes part of the cervix again. So your cesarean section scar, which we call a lower transverse incision, is actually in your cervix. Now, when this incision that we make heals up, in up to 70% of patients after their first Caesar, we can on ultrasound see a little defect. So it is a very common occurrence. That defect invariably is almost always there, but that defect does not need to be repaired. There's only a few reasons to manage that defect. So if your gynecologist tells you you've got an isthmocele or a cesarean section scar defect and you need surgery, no, you don't, if it is not symptomatic. So firstly, it can cause abnormal uterine bleeding. It can cause spotting after a period, because within that little hernia, you can get endometrial tissue, which can respond to hormones, and it may bleed at a different time to when your actual lining comes away with your period. So it can cause spotting, it can cause abnormal bleeding, it can cause painful periods, and it can cause pain with intercourse. And one of the things we are finding today is that it does increase your risk of secondary infertility, because the actual iron and old blood within this little hernia actually is toxic for sperm. So it can become a good contraceptive. Now, if you've had 2 Caesars, your chances of having the cesarean scar defect is even greater. But remember, only a small percentage of patients actually develop symptoms. Now, the next thing that is important is it depends on the depth of this little hernia or defect and how close it is to your bladder, because your bladder lies over this defect. So when one wants to repair it because you are having symptoms, please do not let a doctor just want to fix it because you haven't had symptoms, because then you're going to end up in deep trouble. In most cases, they end up making the scar or the defect even bigger. So always get a second opinion, and preferably from an endoscopic reproductive medicine specialist like ourselves, who are preferably registered with the South African Society for Reproductive Medicine. So if the thickness between the top of the scar and where the bladder is less than 4 millimeters, one has to either fix it via a laparoscopy, or we can fix it vaginally. If that thickness is greater than 4 millimeters, we can actually fix it hysteroscopically, which is a much easier, quicker procedure, and you go home the same day and you have no little cuts or stitches on your tummy. So it all depends on the anatomy of the lesion. It also depends on the experience of the surgeon, and I just want you all out there to be aware that not every cesarean scar defect needs surgery. If you like the video, please give us a thumbs up. Always hit the bell so that you can always be notified as to when we publish the next video. Thank you.